What is the real difference between old and new bipolar ECT? Imagine a treatment that has evolved dramatically over the decades, becoming safer and more effective. That's exactly what has happened with electroconvulsive therapy for bipolar disorder. In the early days, back in the 1940s through the 1980s, ECT was quite different from today's modern approach. Back then, it used sine wave electrical stimulation, which delivered continuous, smooth currents that often caused longer recovery times and more cognitive side effects. Patients frequently experienced confusion, memory loss, and disorientation that could last 4 hours or even days. The procedure was often done without anesthesia or muscle relaxants, making it physically more traumatic and uncomfortable. Fast forward to today, and ECT has undergone significant improvements. Modern ECT uses brief or ultrabrief pulse electrical stimulation, which delivers electrical currents in very short bursts, often less than a millisecond. This change reduces the risk of cognitive side effects and speeds up recovery, with many patients regaining their orientation within just 10 to 45 minutes after treatment. The equipment now allows doctors to carefully adjust the electrical dose based on the patient's seizure threshold, which helps maximize effectiveness while minimizing side effects. Anesthesia and muscle relaxants are now standard, making the procedure much safer and more comfortable. Another key difference is electrode placement. In the early days, electrodes were placed on both sides of the head, which was effective but increased the risk of memory problems. Today, clinicians often use unilateral placement, usually on the right side, or bifrontal placement, which reduces cognitive effects while still providing strong therapeutic benefits. This tailored approach helps balance the treatment's effectiveness with the patient's safety and comfort. When it comes to safety and cognitive outcomes, the contrast is clear. Old ECT had a higher risk of long-lasting memory loss and confusion, partly because of less precise dosing and the absence of anesthesia. Modern protocols have greatly reduced these risks. Many patients experience only minimal or temporary memory issues, and recovery of mental clarity is much faster. Serious complications are very rare and comparable to other medical procedures performed under anesthesia. Treatment protocols have also become more personalized. In the past, fixed doses and schedules were common, regardless of individual response. Today, doctors carefully titrate electrical doses to each patient's seizure threshold and adjust the frequency of treatments based on how well the patient responds. This personalized approach improves outcomes and reduces side effects. Researchers are even exploring new methods like individualized low-amplitude seizure therapy to further refine the process. In terms of use for bipolar disorder, both old and new ECT are effective, especially for severe cases that do not respond to medication. However, modern ECT is considered safer and better tolerated, making it a more accessible option earlier in treatment plans rather than a last resort. Response rates remain as high, often exceeding 70%, with fewer adverse effects and a more positive overall experience for patients. So, the main difference between old and new bipolar ECT lies in the technology and techniques used. Advances in electrical stimulation, electrode placement, anesthesia, and personalized dosing have transformed ECT into a safer, more tolerable, and equally or more effective treatment. It's now a carefully controlled medical procedure that offers hope for many people with bipolar disorder, with a much better safety profile than in the past. As always, anyone considering ECT should consult with a qualified healthcare professional to understand what's best for their individual situation.